a parent looking to change the way you see your child's health? Have you found yourself more inclined to learn about natural remedies and how to use them in your child? We have an opportunity of change for you. My name is Wendy Combs. I am a fellow parent and pediatric nurse for over 20 years, mostly in the field of pediatric oncology. I never gave natural remedies much thought until I had my own children and was looking for ways to help them when health issues showed up. I knew I didn't want to utilize big medicines in little bodies, even though I had been trained in my career to do so. I truly started investigating the side and potential long-term effects of prescription and over-the-counter medicines and decided I wanted to do something different for my family. Let's take ear infections, for example. Did you know that the CDC estimates that 5 out of 6 children will have an ear infection before the age of 3? Sadly, this has become the norm for most children, and the typical first treatment for ear infections is a round of the pink stuff, or amoxicillin. If you're lucky, this might work, but more often than not, the ear infection seems to resurface, and you might find yourself on the repeated ear infection and repeated antibiotic train. Antibiotics are great and helpful, but they are utilized best in more life-threatening situations. And they can also have unwanted side effects of stomach upset, allergic reactions, depleting minerals, and destroying healthy, much-needed bacteria that exist in the intestines. Even the CDC recommends a wait-and-see approach utilizing antibiotics. Yet our most typical approach is to just go ahead and treat without considering the consequences of using the antibiotics. Then there are the pain relievers and fever reducers like Tylenol. I used to consider this a pretty benign medicine, but now I've done a lot of research on this and discovered Tylenol not to be as safe as once thought. It can be toxic to the liver. It depletes a substance in the body called glutathione, a most needed antioxidant. It typically has food dye in it, and some studies have even linked it to the increased incidences of asthma and autism. I have chosen to avoid this medicine in my own home. Wouldn't it be great if you could avoid having to go down this heavy medication route and start with more natural remedies that can safely and effectively treat common illnesses like ear infections or coughs, colds, runny nose, fever, common viral illnesses, or even the tummy bug? Or better yet, transform your family's health with knowing what to do to prevent these illnesses or minimize their stay. Here's a great opportunity of change for you. Get to know natural remedies and be prepared for most anything that comes your way. Stay tuned for the next email where I'll share some personal stories about how natural remedies like homeopathy have been amazingly effective in my own family.